Greetings, PS42 friends and family. I hope all is well. It's Mr. Sharkey just checking in with you. I hope to steal a little bit of your time this afternoon or this evening, whenever you get a chance to watch this. I'd like to share with you some information regarding the COVID testing that is scheduled to be taking place in all New York City public schools, including PS42. So thanks for your time. I promise this will not be a very long presentation. But as we jump into things, before I get into the nuts and bolts of the presentation, I just want to share with you my appreciation again, how happy and proud I am of us as a school community. We opened up our schools now at this time. Every student that is registered to be a PS42 had the opportunity to come in and sit in, depending on their cohort day and their sign day, including our students in grades 1 and 2 due to the delay in the opening of the building. And so thank you. Thank you for your patience as well. As I mentioned in multiple presentations and meetings with families in PS42, the design of the full remote, the blended and in-person learning, the human resource challenges that we're having, it is still very difficult. And thank you for your patience and understanding and working with us. We are sincerely trying our best. I shouldn't say we, our teachers, your teachers. I work for the best teachers, and they are simply doing what they can, and I'm very proud of them. And I'm also, I greatly appreciate your patience throughout the whole duration. Cohorts A, B, and C coming in on your scheduled days too, that's very important. We did have 1 or 2 families the first few days seeming not really clear on their scheduled day, but for the most part, the assigned cohorts every single day have been accurate, and thank you, that's important because we don't want to mix cohort A, B, and C's. It's important for the protocols regarding COVID. And a special thank you to our entire school community, our students, our parents, and staff. The mask wearing has not been one situation whatsoever that we've been concerned with, and social distancing in the morning arrivals and distancing in the afternoon has been extraordinary. So please, thank you, and I appreciate that. Going into all the planning in the back of my head, I was wondering, how's this going to work out? And it worked out. So thank you so much. As I often do in every single presentation, I like to start with our data to really explain who we are and where we're going. So right now, our current school registers is 1,056. That's pre-K to 5. And we did experience a few families leaving to go to parochial schools due to the circumstances with the scheduling and the opening in New York City public schools. We hope to get them back. But again, as a parent, I always say, you know what's best for you and your household. And so right now, our registers are still a very healthy 1,056. 34% of our students are in full remote. That's 361 students, and 695 students at this time are in the blended ABC cohorts, and 66%. So we didn't really change too much in that area. And of course, if you are full remote and you would like to switch over to blended, that is a protocol where the superintendent and principals will have a conversation, and an appropriate time frame will be identified for the transition. And same thing applies if you're interested in going from blended to full remote. You can utilize the return to school learning preference survey. Again, that's for your service. If you have any questions, we can always help you with that. But please understand that because of the constant back and forth, and it is happening, certain families, we're staying balanced for the most part, but certain families are switching back and forth, and others are doing the opposite. And as a result, our registers per class across the grades will continue to be changing. Things are slowing down a lot, but it's just worth talking about once again. So today's intentions, I would like to review with you my understanding and my mindset around the review for health screenings and the practices for COVID-19, taking the assessment here at school. I received some training myself on Friday. And I also would like to sprinkle in at the end our most current status with our ELA and math curriculum materials for our students K to 5. So as we jump into this presentation, of course, will be on the website. Strictly as a website deck, a PowerPoint deck, including this Zoom call. So if I go fast or too fast for you, you can always go back and reference it. But there's a lot of misconceptions, and that's where really what the intention of this is for. I know you received a letter on September 29th from the New York City Department of Health, the DOE, and New York City Health and Hospitals. I have the letter here in front of me, and within the letter, it's a rather large letter, and it has a series of frequently asked questions and whatnot, but I thought maybe the video call will be helpful as well. So students, in a nutshell, pre-K and K will not be participating in the COVID random testing. Only students in grades 1 through 12. So at PS42 is 1 through 5. And so the test and trace division will be randomly selecting students. So in a nutshell, what will happen is we have all of our data in our systems, our ATS systems, and they would approximately 2 to 3 days prior to coming to PS42, they will notify us. We believe they will notify us, or they will look at an assessment or a snapshot of the number of students that they would like to utilize. And so when they do that prior to coming, I'm hoping we will get enough notice, but my training says anywhere between 2 to 3 days, we should be informed that they will be coming to do random testing. By the way, at any given time, anytime we have this protocol, we believe it could be once a month. PS42 staff will always be readily available to support our entire school community. So when people come in, I don't like to say strangers, but when people that come into the building who your children don't know, what I will say is we promise you that there will always be an adult who knows your child and knows our students very well and supporting them. And so as this continues to deepen, if I get new information, I'll share it with you. But what I know now is while consent to testing is not mandatory, there's a very, very big number of inquiries in our virtual general office about this. But it's not mandatory, but what it does, the consent provides the testing supports and the testing agencies enough information. If we have enough people on our school campus, both staff and students, to have a healthy sample, that will be another tool that they can help monitor what's happening in our zip code, our school community, as well as our New York City public schools, especially on Staten Island. And so for tracing purposes, to monitor what's really going on, they're really looking to, and they're focusing on anyone who provides consent, they will be looking to utilize them for those assessments. Students who do not have consent on file may be required to learn remotely if they do not receive the forms, because if they don't have enough people, so they put this literature together, and I believe it lends itself to a lot of misconceptions. So on your behalf, I did an inquiry, and I'm asking the city to really clear that up, because it doesn't sound like the DOE here when it states that, well, if you don't give consent, you're going definitely to remote. It states you may be transitioned to remote. And so as your advocate and your principal, I'm asking for clarity on that. And as I promised earlier, as we get more information, I will forward that to you. But what I would like to just simply say is what I learned on my training and read through the literature, that they are really looking to have the opportunity to gain access to a healthy sample, a population here at our school, both staff and students, so they can do an assessment to see what's happening for monitoring purposes. If this is something you feel strongly about, of course, do not provide consent. And if you have any questions after this, we're always available. If a parent submits consent, if you stated, yes, I'm giving permission, but later on you change your mind, just simply reach out to us in the virtual general office. Specifically, Joan Fazio is our ATS pupil accounting secretary. All of our consent forms get monitored and we enter that information in. And as I mentioned before, prior to the COVID testers that will be coming in and going throughout schools throughout New York City, they have access to this system as well. And so this is all through New York City Department of Education people. So if you want to rethink it and change your mind, just reach out to us and please let us know. Consent for testing is very important. Both staff and students, even if they're attending school one day a month, let's just say, because we do have staff that is not in as much as you think. They might be in multiple schools, and so or working remotely and coming to us. But if they even work one day a month, they're being asked to also provide a consent form, and that consent form will be, that window will last us until September 30th, 2021. And once we receive it, it will be logged into our ATS system, which is a system that we use for pupil accounting, and that's always available to our providers. When the providers come, the people who do the testing itself are trained individuals. We've been informed in my training session, as well as the literature, that it can involve city staff that is trained, school nurses, and partners from the labs that do the work, who do the actual assessments from the laboratories that the city is working in partnership with. I mentioned earlier that whoever comes in, please just to be mindful that anyone that works with children, a PS42 staff member will be there. My word. So the test involves an interior nasal swab, and I Googled that. I had that look that up. In fact, my daughter was very much part of this conversation just last night. She just had this at her school. She's studying at Rutgers for her master's, and she said that it's simply a Q-tip-like material in the front section of your nose. And so that is exactly what we'll be having here in our community. So it's the front part of your nose, a little bit of approximately 1 centimeter in depth into the front portion of your nose using a Q-tip-like swab. And for about 5 to 10 seconds, a sample would be taken. And anyone who's administering the assessment, the medical providers that will be coming in and doing the assessment, will be wearing the appropriate PPE, including gloves. And by the way, every time they do a sampling, the gloves will be removed and a new pair of gloves will be put on for each student and staff member. I'm responsible to be providing conducive space, big open space for social distancing, and an environment with enough ventilation, and it's a conducive enough space for everyone to be doing this in a rapid fashion and a safe fashion. The results and the outcomes. So once the assessment is taken, we're anticipating anywhere between 48 hours to 72 hours to get a result, which is an average turnaround time. If a student or staff member should test positive, they'll be notified by the provider who completed the assessment, and all assessments will be available by logging onto an online portal, and we will provide you all the information to gain access. Test and Trace Corps will also contact any family if should a student identify or a staff member identify with a positive case. And if that's the case, they will support everyone for up to 10 to 14 days due to the window that COVID can affect us in a health capacity. So please, this is a good thing. It's sometimes students might not be aware, or families might not be aware where to go or what to do. So there will be a support built in with this. And again, very, very confidential. So let me explain that a little bit more in greater detail. The data that will be provided to the entire city based on a result from a school. They're not really looking to look at the specifics, but they're looking at us in a global capacity and helping us and monitoring us, not only here at our school, but the neighborhood in which our school is in and the region of Staten Island and across multiple zip codes. As you know, right now on the news, multiple schools in Queens and Brooklyn are closing due to the uptick with the COVID cases. So this is another way the city will be using this to monitor the status of our school communities. All of this information will be confidential. It will be protected by the agencies. It is not for public record. And results will be sent to 2 places specifically, both City and State Department of Health and the Test and Trace Corps. These entities operate with very strict privacy and confidentiality protocols. So please be mindful of that, and it's definitely worth knowing. And so before we end the call, I just want to also say perhaps we reached out to you today. On Thursday and Friday of last week, we had some tractor trailers delivering a lot of our curriculum. The warehouse experienced tremendous delays late summer due to human resource shortages and also shortages of getting materials in. But our curriculum orders finally came in. We're very happy about that. We are unpacking boxes as we speak, and we're reaching out to families, specifically cohort D, full remote families. So in a nutshell, our ELA materials for grades K to 5 have been delivered. The title in the reading program, Into Reading, it is through the Department of Education, and it comes not only with consumables, but it also has digital access for the platforms to support learning both at home and in school. Because of what COVID has done to us all and the types of protocols we're using to teach and learn, the digital platform is critical. So this is a very healthy platform to support the reading and the writing. Our math, same thing, K to 5, both consumables through Eureka Math, and it also has digital access for mathematics. To support mathematics, our teachers have access to INTN. We've been using NTN as a support to develop our teachers and staff, and it is a focus on the mathematics and the standards for assessment tools and whatnot. So that digital platform will be available to us as well. And lastly, our phonics program, word study program, K to 2, will be both consumable and digital access. So please understand that when children receive their books at home, we're asking our teachers to convey this back to their students and their families that we want the books to travel with children. Multiple reasons. We want them because they're home for blended learning besides in person. And if they're full remote, you need to have access to it. But for any other reason, if we ever have to close a classroom due to COVID or a circumstance that we're not able to control and we need to go full remote for a period of time, we want everyone to have access to the materials they need to be successful. So if you have any questions, of course, talk to your teachers. And as I always mention, please, any questions, drop it in the virtual general office. You know where to find that. It's on the school website. I appreciate your time. I hope I didn't go too long. This stuff is very important to many families. Please have confidence and trust us when we expand on the ideas of the New York City Department of Education and what's happening. My job, the way we look at it is we get this information and we deliver it to you in a fashion that makes sense. And if something doesn't look right, feel right, of course, I'm your advocate and I will continue to support you. So please, any feedback, any questions, reach out to us. The parent letter that went home from the city has all the information that I used in this presentation, as well as a frequently asked questions and a document that has multiple parent questions. And so please take the time to read that through. And then if you have any questions moving forward, reach out to us and we'll help you out. Have a great day, everyone. Stay healthy and thank you for your time.